Imagine you're trying to accomplish a simple task, say shooting a basketball at a hoop.
One way to do it would just be to get a bunch of people to throw a basketball as hard as they can at a hoop. However, the basketball will probably miss, and even if it does make, there's a lot of wasted energy and basketballs. Let's try a different approach. If you aim and then shoot the basketball, it'll make it into the hoop with the least energy exerted.
Now, let's take this approach with chemotherapy. In cancer treatment, nanoparticles give chemotherapy this accuracy and precision.
In traditional chemotherapy, a drug is administered to the body. Once inside, it can't differentiate between tumor cells and normal body cells. Instead, it attempts to target any cells that are dividing quickly, such as skin, hair, intestines, and bone marrow. This leads to debilitating side effects, such as bone pain, fatigue, nausea, and vomiting. Nanoparticles solve this problem by serving as vessels to carry the chemotherapy towards their intended target. A nanoparticle is any particle between 1 and 100 nanometers in size. In cancer treatment, nanoparticles are generally engineered organic compounds such as polymers or lipids. There are a few ways that nanoparticles transport drugs. The first way is passive. Nutrients, sugars, and other compounds tend to accumulate near tumor cells. This is called the EPR effect, or increased permeability and retention. This causes tumor cells to also absorb nanoparticles preferentially. The next method is active targeting, where nanoparticles have specific proteins and other structures on them which bind to receptors on tumor cells. The last method is physical targeting, where external sources or fields guide nanoparticles towards their target site. Sounds great, right? Unfortunately, the use of these nanoparticles leads to a different problem. Nanoparticles often get stuck in the blood vessels, and it can be difficult for the nanoparticles to penetrate the tissue that they need to get to. To solve these issues, scientists at the Koch Institute at MIT have created tiny magnetic robots controlled by magnetic waves who use their robotic flagellum or their tails to help them swim. They also use swarms of magnetic bacteria to enhance nanoparticle movement in these cells and tissues. Both of these systems increase convection and blood flow, which leads the nanoparticles in one general direction. These tiny robots and these swarms of magnetic bacteria can both effectively guide nanoparticles out of the bloodstream and towards their intended target, the tumor cells. Going back to the basketball analogy, this is like shooting a layup directly into the hoop.
There's so much potential at the intersection of technology and medicine, and this is just one example where nanoparticles can help save human lives. My name is Trisha Sengupta, and I hope you all have a fantastic day.